When we're talking about special populations, another population that we want to address is the employed. The majority of alcoholics are members of our workforce. We kind of classify them as functioning alcoholics. Some of the signs and symptoms, again, this list is not all inclusive, but some of the signs and symptoms to pay attention to as a manager, as a program director, as an administrator, as an owner of a company, chronic absenteeism, physical signs such as injuries, self-inflicting injuries, falls, broken bones, change in behavior, on-the-job drinking, lost time and lost productivity, especially within an assembly, industrial type of a company, accidents, either self-inflicted accidents or accidents in the company vehicle. Some of the work-related risk factors to pay attention to that set the individual up, for the most part, low structural visibility, freedom to set work hours. If they have the freedom to set work hours, there's no structure. It really is a risk factor for them to deepen within their disease of alcoholism. Workaholics. Many individuals are workaholics that end up developing the disease of alcoholism. Absence of clear goals, absence of supervision if there's not regular monitoring of work performance. These could be risk factors for advancing and progressing into the disease of alcoholism. New work status or reassignments. Required on-the-job drinking, especially within a marketing occupation, where you have to meet with clients at a restaurant or bar and grill. Reduction of social control. The employee has more or a lack of impulse control. Perhaps their social group is starting to become a little bit more colorful. Server stress and competitive pressure. If there's deadlines, if there's numbers that need to be met, these could be added on stressors that can be risk factors for progressing the disease of alcoholism. Some of the treatment approaches to utilize with an employee is the Employees Assistance Program for companies that do have this mechanism in place. Again, that can be offered through their insurance, and everything is confidential, as well as working with a DOT, Department of Transportation, substance abuse professional. If the occupation falls under the DOT, Department of Transportation regulations, then there's some guidelines that need to be adhered to, and the individual needs to be evaluated or assessed by a SAP, a substance abuse professional. In addition, community-based self-help groups can also be suggested and referred for the employee, depending on the level of care that is needed for that particular employee.